To vomit or not to vomit, that is the question. Cannabis? Is it safe? Is there a darker side to using it? Can you overdose from it? And what are the complications, if any, associated with it? I see a ton of patients every day who come into the ER with serious complications, and when I asked if they do any drugs, the most common response is marijuana. Hi, I'm Dr. Jordan Wagner. I'm a board-certified emergency physician. My mission is to make videos that answer your urgent medical questions and clear up myths about various diseases and illnesses. Is weed just a gateway drug with no positives? Or does cannabis have medical benefits? It's the big question on everyone's mind, and it certainly seems so. I mean, there's plenty of information out there describing the potential medical benefits of using cannabis. Even GW Pharmaceuticals, who owns Bayer Aspirin, for instance, has a prescription called Sativex, which is approved in Canada and the UK to relieve the symptoms of MS. We also, in the US, use Marinol, a liquid synthetic form of THC, to help with the side effects of chemo treatment in cancer patients. And there are plenty of other anecdotal case studies where people will say some form of cannabis use has changed their lives for the better. However, those are not the folks that come visit me in the ER. Sadly, as it relates to my work in the emergency department, I often see the negative or the dark side of cannabis use. Every single day, I see patients who come to the ER with serious complications and symptoms from using cannabis, feeling like they're going to die. When you hear the word overdosing, it doesn't necessarily mean death. An overdose is any biological response to when the human body receives too much of a substance or a mix of substances, and it can be accidental or intentional. Just like with federally approved medications, we all can react differently to it. It seems the same with the varieties of cannabis. When you typically hear of someone overdosing from a drug or a medication in the ER, usually as a physician, we worry about breathing problems or organ failures, and with most drugs, we have antidotes to combat these complications. With marijuana or cannabis, this is not the case. We don't have an antidote in the emergency department. So what kind of cannabis complications are we talking about? I can tell you a ton of crazy and cool stories as it pertains to patients who come in with weed complications, but that would be a HIPAA violation. But generally speaking, the types of sick patients I see come into the ER, their issues like they've used some sort of tainted weed with mold or fungus, they have reactionary cyclic vomiting, overdosing from eating too much edibles or smoking too much weed with high potency, overdosing from patients who have unknowingly used synthetic or chemically altered weed. Symptoms. Symptoms range from paranoia to anxiety, the palpitations, to being stoned, where the patient is actually quite sedate and sort of out of it. The length of time it lasts is extremely variable, hours to days, meaning the patient likely will be hospitalized. To vomit or not to vomit, that is the question. There are plenty of stories of patients who use cannabis, often to help with nausea for a broad spectrum of reasons, including stopping the nausea feeling from chemotherapy. But on the other side of the coin, more recently, a new medical diagnosis has come out called cannabinoid hyperemesis syndrome. This is the diagnosis for cannabis use that actually causes vomiting. Yes, although for some people it helps with the vomiting side effects, in other patients that I often see, we have to admit them to the hospital having severe bouts of vomiting and dehydration caused by cannabis use. It is rare and occurs typically in a daily, long-term user of cannabis. Cannabis has very complex and wide-ranging effects on the body. Is it too strong of weed? Has the cannabis been tainted? Is your body reacting as some people's bodies react when they have an allergic reaction to certain foods or medications? Doctors and experts are still trying to learn exactly how it causes cannabinoid hyperemesis syndrome in some people. Have you ever thrown up after cannabis? You may have this syndrome if you have all of these following: long-term weekly and daily cannabis use, unexplained abdominal pain, severe repeated nausea and vomiting, and you feel so much better after taking a hot shower. There's no single test that confirms this diagnosis, but these patients do see a great improvement after quitting cannabis use. Okay, other general cases physicians see in the ER. Psychosis is a severe mental disorder in which thought and emotions are so impaired that contact is lost with the external reality. I have had patients who say they have only used cannabis have severe psychotic breaks that require police involvement, physical restraints, spit masks, and antipsychotic medications to help these patients get through their psychotic episode. So the question that still needs to be answered is, does cannabis increase your risk of a psychotic break randomly, or does it accelerate someone who might be predisposed to a mental illness? Or can the cannabis be laced with a chemical that we can't detect, causing such issues? Some studies reported that people who use cannabis on a daily basis were 3 times more likely to have the first-time diagnosis of psychosis, and 5 times more likely if they used high-potency marijuana every day. Another issue I see often in the ER with patients who claim that they've only used cannabis products is heart problems, especially in younger patients. These problems are things like sinus tachycardia, atrial fibrillation, ventricular fibrillation, or in other words, an irregular fast heart rhythm. There have been retrospective papers written that have tried to link dangerous heart rhythms to young patients using cannabis, which include atrial fibrillation and ventricular fibrillation, but more research is needed to define any correlation. I do often see it in the ER though, and for those types of patients, we search for the cause for the heart rate being so fast, as well as treat it with fluids and likely antiarrhythmics. Another question I get a lot: can smoking marijuana cause cancer? As of now, cannabis has not been shown to cause cancer, but as I've said before with smoking anything, there's always a risk to the lungs, not just to cancer, but since this isn't regulated, you may not know all the components in what you were smoking. Just like when we were kids and our parents said, don't take candy from strangers, be aware of what you're using and where you're getting it from. Also, plenty of lung injuries still associated with vaping products, and the American Medical Association has called for a total ban on all vaping products due to serious lung injury. All right. So what do you do now? Ask yourself, how is your cannabis use affecting your health? If it is negatively, speak with your doctor. We may not be able to give recommendations on which weed variety is right for you, but we can discuss cannabis use as it relates to your health. My general rule is the only thing going in your lungs should be air. But as we know with any medication, drug, food, vitamin use, every patient is unique and different. So while some people may have positive outcomes and benefits like seizure reduction, reduction of anxiety, etc., others that I see in ER do not. Currently, most of what we know is anecdotal or based on a person or a patient's unofficial accounts, because in the US, cannabis is still considered a Schedule I drug, which under federal law means that there is no medical benefits. Perhaps, over time, as the laws change, we will see a system in the future where we actually have proper dosaging and antidotes. We will see less overdosing cases and adversely affected patients come into the ER, and much more of the medical benefits as it becomes more widely used and studied. All right, that's been your 5 minutes on a few of the worries of cannabis use with me, Dr. Wagner, and I hope I've cleared up some questions that you may have had surrounding reasons why people come to the ER after the use of cannabis. If you have more questions or concerns, please leave me a comment, or if you'd like me to do a video on the alleged positive effects of the cannabis use, let me know that too. Also, make sure you subscribe and turn your bell notifications on. Please hit the like button so I can keep making medical videos like this. Thank you so much for watching, and stay healthy, my friends.